Hi, my name is Shelby Marmer, and this is my project. The rate of pressure ulcers on 5 Center are steadily increasing every month. The purpose is to implement a standard order protocol for the use of Alevins to prevent pressure ulcers on patients 65 years or older and who score below an 18 on the Braden scale score of the time of admission. The aim is to have 5 Center have no pressure ulcers every month. The problem. Pressure ulcers are localized injury to skin and or underlying tissue, usually over a bony prominence such as like the sacrum and heels. Healthcare associated pressure ulcers can cause different medical complications such as UTIs. They can increase the length of stay for the patient and they can be costly for both the hospital and patients. It costs the U.S. around $11 billion to treat an ulcer, while it takes $500 to $70,000 for the patient to pay to get to treat an ulcer. The current costs on 5 Center are unknown at this time, and 5 Center has a standard protocol for preventing ulcers, but it does not include adding Alevins. It includes turning and positioning every 2 hours, proper hydration, and maintaining the patient, having them be dry. The clinical question. C. Patients above the age of 65 who have a Braden scale score of 18 or less at the time of the admission. I. Placing Alevins on the sacrum and heels of the patients while also maintaining the standard protocol. C. No Alevins but still having the same protocols, and the outcome would include decrease the current pressure ulcer rate from 1 to 2 per month to 0 by the end of December 31st, 2018. The search process included finding a database for my evidence-based articles, which I used the CIN-AHL database. I used different keywords, which included pressure ulcers and prevention, pressure ulcers and Alevins, and pressure ulcers and CMS. I used different inclusion criteria to narrow down the results, which included 2013 to 2018, English, evidence-based articles, research, and full text. The number of citations I received vary for each keyword, which can be found at the search table in the next poster area. I used different exclusion criteria, which include that the level of evidence was greater than 3, the dates were greater than 5, and they were non-research-based articles. After adding the inclusion and exclusion criteria, I narrowed down the results, and I ended up only using 5 articles out of the entire search because that's what matched my clinical question. The data extraction and recommendation. The articles showed that pressure ulcers are relevant despite having the standard protocols in place, and the evidence also points that patients are at high risk of developing an ulcer, then an Alevin should be added prophylactically. The recommendations include 1. Assessing the patient on admission for skin issues with another nurse using the head to heels documentation and document it accordingly. If the Braden scale score is less than 18, Alevin should be placed on admission, and the Braden scale needs to be done 24 hours of the admission. 3 would be skin checks every shift and replace soiled Alevins. That includes educating other staff, such as your aides, that if they change the person and the Alevin is soiled, then to either replace it or get the nurse to replace it for them. 4 would include maintaining standard protocol of Catholic Health, and 5 would include if the patient has any wounds, place a wound care referral. The wound care referral helps with the pressure ulcers, because if you don't know if it's a stage 2 or stage 3, or if it's like more sure associated, then the wound care nurse can come in and say, you know what, this is a MASD, this is how you treat it, instead of having a pressure ulcer, because sometimes they can look the same. The table of search evidence includes like all my different articles that I used, the sample characteristics, like what the design was, the interventions that they used, what the findings were, and then what I thought and what the strength was for each of the articles. But the majority of them all pointed into the direction that Alevins help and that pressure ulcers are still a huge thing. The IRB involvement includes the Catholic Health is partnered with IRB and has their own team that includes having a team of more than 5 but less than 25 members, and If the manager and a researcher has a study that they want to conduct, they must fill out the proper documentation, which is found on the Catholic Health website. And it asks like what the study is, who are the participants, if they're going to get reimbursed, like why do you want the study to happen, and then they hand it in, and then the team will decide yes, they fit all the criteria, um, and they will decide if the study can go on or not. But because this is a qualitative improvement study, IRB approval is not necessary according to my manager. Methods for implementing the protocol include using the PDSA. Um, the plan is the proposed practice change on the unit is requiring RNs to assess the patients using the Braden scale to determine how high risk a patient is in developing ulcers. If they're high risk or if they are high risk and score below an 18, the leavens must be placed on both sacrum and heels as prophylactically. The step 2 is due, which includes educating staff to make the change happen. During the unit's weekly huddles, the assistant manager will hand out flyers that include pictures of Alevins, proper ways to place them, and the different stages of pressure ulcers, just as a reminder. The flyers will be hung around the unit and at each nursing station for our staff to reference at any time. There will also be continuing education for the Braden scale and how to assess the patients using the standard protocols for Catholic Health. Patients and family members will also be educated on the purpose of wearing Alevins because sometimes they might be uncomfortable, but they are more beneficial for them. No equipment is needed, forms are not needed, and the only supplies needed would be including various sides of Alevins, such as small, medium, or large. Costs are unknown at this time, and the third step of the plan is to study. The managers will look at the trends of pressure ulcers on the unit at the end of each month to see if they decreased or increased. If they increased, a new research needs to happen to figure out why the issue is still happening. Is more educated needed? Is staff compliant with the new protocol, or are they forgetting to put new Alevins on when they become soiled? The final step would include ACT. At the end of December 2018, 5 centers should have decreased the rate of pressure ulcers to 0 by the use of Alevins and standard protocol. 5 center will add Alevins to their standard protocol, and this means that the hospital will also start using Alevins to prevent pressure ulcers. Methods for evaluating the practice change in order to see if the intervention works. The researcher and manager will need to look at the trends of pressure ulcers prior to the study. This will allow the researcher to get a baseline of how many pressure ulcers were formed and be able to compare the results at the end. The researcher and manager will observe the rate of pressure ulcers on 5 center from November 1st to December 31st, 2018. At the end of December, the manager will be able to answer the following questions. How well did it work? Was it cost effective, and did it improve quality and safety indicators? By observing and documenting the trend of pressure ulcers on the unit at the end of each month, the manager should be able to see the rate go down from 0 pressure ulcers a month by adding Alevins to those specific patients. Alevins do improve quality and safety indicators. Not only are healthcare associated pressure ulcers costly for both the patient and hospital, they can be very painful and lead to other hospital-acquired illnesses. Alevins prevent the pressure ulcer from forming, which alleviates any complications that could arise from them. At this time, with information provided, there is nothing that states that this intervention was cost-effective on this specific unit. The CMS stated, the reduction in healthcare-associated pressure ulcers could result in the significant financial gain for the institution, which could incur direct costs of $130,000 for a single stage 2-4 pressure ulcer, as well as potentially more in legal settlements. How will this practice be sustained? Upper management and the policyholders will need to have evidence-based information regarding the benefits and costs of adding Alevins prophylactically. The evidence can be found in different articles and from the study itself. And then the main resources to sustain the change would include having enough Alevins on the floor and on all units. These items can be obtained from the hospital supply rooms, and they can be delivered by an outside source, which is the hospital's choice. The intervention of adding Alevins prophylactically can be incorporated in the entire hospital and can be updated in their standard of care protocol policies online. After the study on 5 center decreases the rate of pressure ulcers and Alevins, the entire hospital will implement the same policy. The education department will go to each unit and educate staff regarding Alevins using the same flyers that was used in the pilot study, and they will be placed at each nursing's desk. Thank you.